This is Leanna Babb, RN, with my PowerPoint presentation titled Forgotten, Alzheimer's Disease. This nursing research PowerPoint was prepared for my class, Nursing 341, at Spring Arbor University. Most people can relate to the feeling of walking into a room only to forget why they entered the room to start with. Now imagine feeling that way throughout the majority of the day. Alzheimer's dementia is named after a German doctor, Alois Alzheimer, who recognized a negative change in his patients' ability to complete their activities of daily living due to cognitive changes. This can happen very slowly and gradually, which makes the identification of the changes difficult for the patient and those around them. 5 years ago, the number of people suffering from dementia was approximately 36 million worldwide. In order to correctly diagnose a person with Alzheimer's dementia, it helps to have an idea of who might be the most likely candidate. Years of research have provided a somewhat general idea of who might be at a greater risk for developing the disease. Both men and women are equally likely to develop Alzheimer's dementia. Being greater than 60 years old when symptoms begin and having a family history of Alzheimer's dementia are key risk factors. There is very little definitive research regarding the pathophysiology of Alzheimer's dementia. It is generally agreed that Alzheimer's develops when there are changes in the white matter of brain. More specifically, white matter ischemic damage is thought to be an important contributor to Alzheimer's disease. Restoring the lack of perfusion and oxygenation reaching the brain's white matter could potentially hold the key to finding a cure for Alzheimer's dementia. The most commonly recognized symptoms of Alzheimer's dementia is memory loss, but it isn't simply the loss of the ability to recall information that lends toward the diagnosis. Due to the damage within the brain, the ability to obtain newly acquired information is a more decisive indicator. A list of symptoms that are indicative of Alzheimer's dementia are memory loss, confusion, disorientation, suspiciousness, trouble with talking, walking, and swallowing. Although these symptoms could point to other diagnoses as well, when all of the symptoms are present, it is likely that the patient is experiencing Alzheimer's. Once a patient presents with all or many of the signs and symptoms, the next step is diagnostic testing. Much of the diagnostic testing to identify the presence of Alzheimer's dementia is image-based. The following tests are utilized to identify the reduced brain size due to the lack of perfusion: PET scan, CT scan, and MRI scan. And there's also a test that can be ran on cerebrospinal fluid to identify the presence of vascular endothelial growth factor. Identifying an increased VEGF concentration in the cerebral cortex and CSF can be indicative of Alzheimer's disease. Alzheimer's dementia is a scary diagnosis for many, especially since there is no cure and very little available in the way of pharmaceutical management. As the patient's disease progresses, they lose more and more cognition. Ideally, the disease will be recognized early in its onset so that family and medical personnel can help the diagnosed with living safely. If management is facilitated well, then the patient should have fewer occasions to be a danger to themselves or others. Thank you for reviewing my PowerPoint on Alzheimer's dementia. If you would like to research further, please review the following references.